the junior doctors can't come today, contrary to rumours that we don't have a 5-day at NHS. Quite a large number of them are working today, and we've got statements for them. I think it's important to say that this protest is about privatisation of the NHS, but first and foremost, it's a statement of support for junior doctors who've been fighting at the forefront to defend services. It's not about their wages, it is about the service and their conditions of work. I think everyone's very grateful to what they do for us, so please welcome Sarah.
Hey!
Okay. I'm not used to holding these. My name's Sarah, I'm a junior doctor at Gloucester Royal Hospital. I just want to start, first of all, by saying, and I think I speak on behalf of my colleagues as well, that we've been absolutely overwhelmed by the amount of support that we've had from the public. It's been really tough, actually, for the last few months. Morale has been really low amongst the doctors, and it's made such a difference when we feel like we can't fight on, we haven't got anything left to give to this, and then we turn around and we see people like yourselves supporting us, and that's what keeps us going, and that's what reminds us what it's worth fighting for. So thank you so much for your support.
Thank you.
The second thing I want to say is this isn't a moan about how tough it is to be a junior doctor, because I love my job, and of course it's tough, but I knew it was tough before I started. It's exhausting, it's emotionally, physically, mentally draining, but it's incredibly rewarding, and I love it, and I'm so proud to be able to call myself an NHS doctor. I was just asked to say what it's like as a junior doctor and what this contract might mean for me and my colleagues. So last Friday I finished my 90-hour week, and I work on a 1 in 6 rota, so that means I do that every 6 weeks. I have a 90-hour week, which is 6 days of 12.5 to 13-hour shifts, sandwiched between 2 7-hour days. And if that sounds brutal, it's probably because it is brutal. But looking at what the contracts and what the rotas would be for next year, if this contract was pushed through, it looks even worse. I had a look on the NHS employers website at what their suggested rotas were, and there are rotas of doctors working 48 hours straight. Does anyone want to be treated by a doctor who's just finished 48 hours? No! There are rotas of 9 days in a row, which flip between nights and days without any time to recover in between. Having worked a night shift, and I can tell you it takes around about 48 hours to feel human in the day again. And I think this is where the issue is, that these rotas are being churned out with the expectation that doctors can act like robots and switch on and switch off. But we need time to recover to be able to give it our best again when we start the day shifts.
Yeah.
There are rotas of people working every other weekend. And with the pay that doctors will get going down at the weekend, there are doctors that have young families, and the cost of childcare at the weekend, I don't have children, but I'm told it's A, incredibly difficult to get, and B, if you can get it, very expensive. Now I work, one of my colleagues, she has 2 young children. She's an incredible doctor. She's amazing with her patients. She's so hardworking. She's so intelligent. But she looked at the rota for next year and how much she would get paid and how much it would cost her to put her children in care while she comes to work. And plus the costs of exams and the mandatory courses, which can be around about £1,000 each that we pay, and the GMC registration and the insurance and the student debt. She just worked out it wasn't going to be financially possible for her to continue working and continue training, and that's a really sad loss, because she's a wonderful doctor. She's the one I want looking after me when I get sick, and that's not an isolated case, unfortunately. Lots of the conversations at work at the moment are, what would you do next year if this came in? And the general theme is, well, for people in this region, to move to Wales is an option. People are talking about moving to Scotland. and there's also people moving even further afield to Australia. And worryingly, people who have, say, taken a year out and gone to get more experience abroad in Australia or New Zealand in the last couple of years aren't coming back. It's not uncommon, it hasn't been for years, for doctors to go away for a year and bring back that experience back to the NHS. But now they're not doing it. They're looking at the mess that we're in, and they're understandably staying there.
Sure. Yeah.
So I agree, I think we do need more doctors to work at the weekend, but we need more doctors to work Monday to Friday as well. And stretching what we've got over 5 days to try and stretch that over 7 days, well, it doesn't take a genius to work out that that's not going to work. We've got huge gaps in our rota already. We can't fill the gaps that there already are. And with doctors moving abroad, doctors just throwing in the towel and saying they can't carry on working like this, they can't keep going, they can't afford to leave their family and go to work, there are going to be even more gaps. So my fear is, and it's been touched on before today, my fear is that the government doesn't mind if doctors work, because actually that opens up the space for private companies to take in.
Yeah.
So we have one of the best healthcare systems in the world, and I love working for the NHS. We're the envy of the world, and I'm not going to give up fighting for that. So thank you all for your support.
Thank you. Thank you.
For today, I've got one statement from another doctor that I said was working. From John Smallwood, who writes, in my opinion, there is nothing more important to the well-being of a country than the health of its citizens. By ensuring that everyone is entitled to free health care, regardless of the circumstances of their birth or upbringing, we create an environment where no one needs to live their life in fear of unforeseen medical problems. I go to work each day and meet people who are grateful for the service the NHS provides. People who would have been unable to afford or would have been abandoned by a private healthcare system. I know the NHS isn't perfect. I work in it and I see the flaws within it. But day in, day out, I treat people who are grateful for the service we provide. People who have had world-class, life-saving care provided free of charge at the point of delivery. The NHS saves lives. It is the best option available to our country. To privatise our healthcare system would show blatant disregard to the well-being of our nation as a whole and open the doors to the inequality and suffering of thousands. To claim privatisation would save money is a blatant lie. Public healthcare systems have repeatedly been proven to be cheaper per head than a comparable private healthcare model. The junior doctor's contract is the first step towards undermining the functionality of the NHS, opening the doors to the end game for the privatisation of the NHS. Please do not let this happen. If the doctors lose, the government will attack other healthcare professionals. This has already started by the abhorrent removal of the students' nurses' bursary. Speak out, fight for what is right, defend our NHS. John Smallwood, Junior Doctor. We're asking everyone to gather behind the NHS, Save Our NHS banner, which will go at the front of the march, and we'll now proceed through to Montpellier Gardens where there'll be more speakers. If you could line up behind the NHS, Save Our NHS banner. And